So before I go in the room, I would check the orders, make sure there was an order for a dressing change, go in, provide privacy, perform hand hygiene, ask the patient to identify themselves and tell me their name and birthday. I would check that with their armband, and then I would introduce myself and explain that we are changing their dressing for their port, taking off the old one, putting on a new one. My patient would be wearing a mask, I would be wearing a mask, and I would have the head of their bed elevated and their arm out straight. And while I'm changing their dressing, their face would be turned away from the side that their port is on. So hand hygiene, I would have my mask pulled up, clean gloves, and I would take off the old dressing while holding the port down so I don't pull on it. Take off the old dressing and put it into a biohazard bag. Then take off my clean gloves, put them in the trash, perform hand hygiene again, and then I'm gonna turn so you can see my sterile field. Will you scoot back? I'm gonna turn the camera just to the sterile field. Sorry. Okay. So open up the sterile field. Put on sterile gloves. And then I would take a chlorhexidine swab and clean around the port. I'm just going to move the camera back. Clean around the port, and you'd clean the whole area that the dressing is going over. So clean around it. And then you would clean the tubes close to the port in a downward motion. And then once that's dry, you'd put on the skin protectant. And then the Tegaderm. Once that was on, you would take another chlorhexidine swab and clean down the tubes. And then you would change out the caps on the ends of the tubes to clean ones. And the whole time, these are supposed to be clamped off. So change out the tubes. And then take the sticker from the Tegaderm, write the date, stick it onto the Tegaderm. That tells you when the dressing was last changed. Hand hygiene, make sure the patient's bed is down in its lowest position, give them their call light, and then provide the correct documentation.